Welcome to the St. Anselm College Concussions Educational Module for Coaches. A concussion is a mild traumatic brain injury from contact to the head or a hit to another part of the body that transmits force to the head. In the event that an athlete sustains a concussion, they may feel headache, fatigue, nausea or vomiting, double or blurry vision, sensitivity to light or noise, feeling sluggish or slowed down, feeling foggy, having problems concentrating or remembering, or changes in mood such as irritability, sadness, nervous, or anxious. If you suspect that an athlete has sustained a concussion, you may see a loss of consciousness for any amount of time. They appear dazed or stunned, unsure about game, score, or opponents, confused, forgetful, have difficulty remembering, move clumsily, have balance problems, personality changes, and respond slowly to questions. It is important to make sure that a suspected concussion is diagnosed and treated early to prevent life-threatening injuries like second impact syndrome from happening. While rare, it is catastrophic and a major concern. All incoming athletes are required to have baseline neuropsychological testing before they are allowed to participate. This includes the impact test, best balance test, and SCAT-5 test. The impact test is a computerized test that measures concentration, memory, visual, and verbal problem solving. This test takes about 30 to 45 minutes to complete and can detect faking bad or trying to get bad results on baseline testing. Athletes may be asked to retake it if it appears they were not trying. The BEST test, also known as the Balance Error Scoring System, is when an athlete holds 6 different positions for 20 seconds each, with their eyes closed and hands on their hips. Scores are based on the amount of times they lose their balance. The last test is the SCAT-5 test, which is a one-on-one session with the athlete and the athletic trainer. This takes about 5 to 10 minutes to complete, and it tests concentration, memory, and coordination. If you think your athlete has sustained a concussion in the absence of an athletic trainer, recognize, remove, and refer. Recognize the concussion, remove them from activity, and refer the athlete for a medical eval. Coaches should seek assistance from the host trainer if in an away contest, and the coach is responsible for notifying the SAC athletic trainer. If there's any question about the status of the athlete, they should be referred to the ED for eval, and the coach should ensure that the athlete will have a responsible individual to take care of them at home. The procedure for concussions includes the evaluation by an athletic trainer, communication, physical rest, mental rest with academic accommodations, post-concussion cognitive testing, progression, and clearance. The initial evaluation by an athletic trainer includes assessing the injury and what happened, assessing signs and symptoms, conducting neurological assessments, re-administering SCAT-5 and BEST tests, monitoring change for a period of time, assessing the needs for further medical attention, and facilitating take-home care plans. An athlete will be immediately referred if there is any single or combination of prolonged loss of consciousness, seizures, deteriorating signs and symptoms, unequal, dilated, or unreactive pupils, and significant amnesia, with serious consideration for vomiting, severe headache, prolonged disturbance of vision or hearing, and paresthesia. If symptoms don't improve in a 2-hour time frame post-injury, the athletic trainer will exercise clinical judgment regarding referral at that time. Other delayed referrals include when neurocognitive test scores are not within normal range 7 days after resolution of symptoms, and also if symptoms remain for over 14 days. Once a concussion is diagnosed, the athletic trainer will communicate with the person who will be monitoring the athlete throughout the day or night to ensure they understand what to look for and do, their coach and strength and conditioning coach, health services, the team doctor, and a neuropsych who will be analyzing their tests. Health services will then communicate with Res Life, campus security, an academic dean, ARC, and faculty athletics rep regarding the athlete's neurocognitive and recovery status, if needed, and or initiate procedures for academic accommodations. Although health services alerts their dean, it is up to the athlete to keep their specific professors up to date on what's going on. Roommates should be notified the day of the suspected concussion. A home care instructions for athletic head injury sheet shall be given to the athlete or roommate. This should include tips to help care for a concussion, symptoms to look out for, and contact information. After initial injury, it is important to let the athlete rest so their body can focus its energy on healing. It is important to encourage the athlete to continue eating normally and staying hydrated as the body is working hard to recover. As the athlete starts to feel better, they will be allowed to slowly increase activity at the direction of their trainer. It is important not to push the athlete mentally if they are experiencing symptoms, as that may hinder healing. Based on the symptoms they are experiencing, accommodations should be made. If the athlete is experiencing light sensitivity, some accommodations are dimming the lights, adjusting screen brightness, allowing them to wear sunglasses or hats, and allowing them to just listen to the lecture and not take notes. If the athlete is experiencing sensitivity to noise, some accommodations are allowing them to wear earplugs to dim the noise, give them the notes so they can read instead of listen, let them avoid big, noisy classrooms, maybe meeting one-on-one might be better, and avoiding large gatherings. Accommodations for difficulty concentrating or focusing, including breaking down assignments into small chunks of a half hour or less with breaks, issuing short and concise written instructions or step-by-step sequences, allowing them to take tests in a separate quiet room, moving the student's seat to the front of the room, or using color coding and highlighting. If an athlete is having difficulty remembering, they can ask the teacher to provide class notes or suggest the use of a tape recorder, the use of fact sheets on tests to reduce the demand on their memory, multiple choice or open book tests, and help the student devise ways to memorize info. If the athlete is having difficulty organizing or with time management, you can encourage and assist with the use of a planner, use to-do lists and checklists, use diagrams, timelines, and charts to organize information and projects, and check the student's comprehension of directions and allow them to repeat the information in their own words. A SCAT-5 and BEST test will be issued immediately after injury and again as needed throughout recovery. The impact test will be within 24 to 72 hours after injury, once asymptomatic for 24 hours, and again after moderate exertion. Each impact test is evaluated by our off-site neuropsych and compared to baseline. Throughout their recovery, the athlete will check in daily with their athletic trainer on how they are feeling. Based on symptoms, the athletic trainer will develop recommendations for academics, socialization, and physical activity. Academic progression should start with no class when symptoms are too high. When symptoms start to subside, they can add small amounts of time for easy work. Then partial academics might be one class a day, should be allowed to sit in the back of the class if they need to leave, prioritize work that needs to be done, and make accommodations based on symptoms. Full academics with accommodations is increasing back into classes. Continue to limit the busy work, but can gradually increase the amount of work they do. Limit to one test a day max and continue specific accommodations. Full academics with no accommodations is when they no longer have symptoms. Construct a plan to help them with missed work. The physical activity progression includes light activities of daily living, light aerobic exercise, sports-specific training, non-contact training drills, and full contact training. If symptoms persist for more than 14 days after injury, the athlete can be referred to a specialist. Final clearance will be from our team physician at the discretion of the treating athletic trainer. We will not accept a clearance note from a different doctor. Thank you for taking the time to watch our concussion video.